welcome to our Monday Minute. Today, I want to discuss with you the Medicare Open Enrollment period and how that impacts both home health and hospice. Medicare Open Enrollment is currently active and will be so through December 7th, where patients have the opportunity to join a Medicare Advantage plan, to switch from one Medicare Advantage plan to another, and to switch from Medicare Advantage plan back to traditional Medicare. There are tons of changes that will occur during this open enrollment period, with the anticipation that any changes that do occur during this open enrollment period will go into effect January 1st. Keeping in mind that agencies may be fully unaware of what has transpired with their patients' coverage. Many times the patient don't even realize what's happened. You need to make sure that you're talking to your FID staff about being heightenedly aware of the conversations or comments, etc., that they may hear from their patients regarding the patient's healthcare coverage. You need to have your clinicians to have conversations with the patients about the fact that if they have any letters, any new cards, etc., regarding their healthcare coverage, that they should make sure they show it to the home health or hospice. For hospice, of course, the VBID model that began 2 years ago is in full bloom. There will be 119 benefit packages under the Medicare Advantage plans that will be participating in the VBID demonstration for hospice starting January of 2023. So for hospice, instead of just looking to ensure in the eligibility process that your patients have Medicare Part A, you need to be very detailed. And if the patient has any Medicare Advantage coverage at all, you are going through the details to determine for sure whether or not this patient's plan is involved in the VBID demonstration. If it were to be, you will have to bill both traditional Medicare and the Medicare Advantage plan in order for you to get paid for the hospice services for those patients. Our heavy recommendation to all agencies forever has been that you should check all patients' Medicare eligibility for at least the first 3 months of a new year, January, February, March, at least 2 to 3 times in that month. Sometimes even changes that occur during open enrollment do not typically, or do not always, let me say that, show up in the Medicare system as quickly as we would like it to. So you need to make sure to stay on top of that. If the system is not updated timely, and when you checked the status, it was not present, you will be able to get exception with any penalties, etc., that might have caused with billing. But you do have to be able to prove that the changes were not in the system when you checked. So that means you need to keep a screen print, etc., of the eligibility verification of your patients as you are checking them. And I recommend you do that throughout the year, not just in those first 3 months of the year. I hope this has helped some today. I do strongly encourage you more than anything to have your field staff have the conversation with your patients about making sure that they notify you of any changes in their healthcare, any new letters that they receive in the mail, any cards that they receive in the mail regarding healthcare, so that you stay on top of the patient's correct payer. I hope you have a fabulous week, and please let HPS know if there's anything we can do to assist you.